Welcome to the module on vital signs. This module focuses on blood pressure. Let's quickly review the key learning objectives of this module. After completing this module, you will be able to explain why and when blood pressure is measured, accurately measure blood pressure, know factors that affect levels of blood pressure, avoid common mistakes while measuring blood pressure. Let us now understand what vital signs are. Vital signs are physical signs that indicate an individual is alive. They include pulse or heartbeat, respiration, blood pressure, temperature. When do we measure vital signs? We measure the vital signs when a person complains of not feeling well, or when a patient is admitted to a hospital. It is a regular activity to measure vital signs several times a day for hospitalized patients. It is done before and after surgery or some nursing procedures. We measure vital signs before medications are given that affect respiratory or circulatory systems. So what is blood pressure? Blood pressure is the measurement of the force exerted by blood against the walls of the arteries. It is measured in millimeters of mercury, mmHg. It has two values. First, one is systolic blood pressure. Systolic BP is the highest pressure in the large arteries when the heart is contracted and pushing blood. The second one is diastolic blood pressure. Diastolic BP is the lowest pressure in the large arteries when the heart is relaxed. Take a look at this figure. What do you see? This figure highlights the different ranges of BP. BP is shown as systolic by diastolic values. Ideal adult blood pressure is 120/80 millimeters of mercury. The normal systolic range is 140 to 90 millimeters of mercury. And the normal diastolic range is 90 to 60 millimeters of mercury. Now carefully look at the abnormal range of blood pressure. There are two stages in the abnormal range of BP. When blood pressure is high, it is called hypertension or high BP. It has values above the normal systolic 140 or diastolic 90 pressures. Low blood pressure is called hypotension or low BP. It has values below the normal systolic 90 or diastolic pressures 60. Why do you think it is important to measure BP? Blood pressure pushes blood to various parts of the body. Also, accurate blood pressure measurements detect high or low BP. Click the images to know more. Did you know that high BP is the primary factor in about 70% of heart attacks, 75% of strokes, and other serious diseases? Did you know that low BP leads to dizziness and fainting? In severe cases, it could damage the heart and the brain. Now let's look at the factors that affect blood pressure. Click the images to know more. Age. BP increases for older people. Gender. Women usually have a lower BP. Blood volume. Severe bleeding lowers BP. Stress and pain increases BP. Exercise increases BP. Click. Weight. Overweight people have a higher BP. Diet. High salt diet leads to high BP. Images. Position. BP is lower when lying down. Now let's look at some of the equipment which is used to measure BP. A blood pressure cuff is called a sphygmomanometer. Other common types of BP equipment include mercury, aneroid, and recently, digital ones. Let's now understand the pulse sounds. The Korotkov phases help us understand the pulse sounds when the BP cuff is slowly deflated. First phase. The sound will be sharp thumps at the start during systole. Second phase. The sound will be a blowing sound. Third phase. The sound will be soft thumps midway. Fourth phase. The sound will be of softer, fading thumps. Fifth phase. There will be silence, diastole. Now let us see the steps to measure BP. Click each step to know more. To measure BP, first ensure that the patient is ready. Check if the patient has relaxed for at least 1 hour and no painful procedure has been done. No food, drink such as coffee has been consumed or the patient has smoked. Ensure the patient is in the correct position. Is seated for 5 minutes and the upper arm is exposed. Roll up the sleeves. Ensure the patient's arm is at heart level. The second step is to get the equipment ready. Get a stethoscope, a BP monitor with the right-sized cuff, large, medium or small, which will fit the patient's arm. Place them on the table. Now let's look at the actual procedure. To measure BP, you need to clean stethoscope earpieces and the diaphragm with alcohol. Locate the brachial pulse on the forearm. Wrap and fasten the cuff so it fits snugly on the arm, 1 inch above the elbow, with the arrow pointing to the brachial artery. Place the stethoscope diaphragm on the brachial artery and locate the pulse. Close the valve of the BP cuff. Then inflate the cuff until you can no longer feel the pulse and inflate to beyond 30 millimeters of mercury. Deflate the cuff slowly at 2 millimeters of mercury per second while listening for a pulse sound. See Korotkov scale for guidance. Note reading when you hear the first clear, regular pulse sound, systolic. Continue listening until the sound disappears. Note this reading, diastolic. Open the valve to deflate completely and remove the cuff from the patient. Now let us see a demonstration on measuring BP.
Welcome to a video on blood pressure. This video is brought to you by Vadhvani Foundation. Material needed: alcohol, stethoscope and BP monitor with right-sized cuff. Step 1. Preparation. Make sure that the patient has relaxed for at least an hour before the procedure. That means no painful procedure is done on him, nor has he consumed food, drink or smoked. Lay down the patient with his or her upper arm exposed. Roll up sleeves for 5 minutes. Ensure the patient's arm is at heart level. Step 2. Procedure. Wash your hands with alcohol solution. Clean stethoscope earpieces and diaphragm with alcohol swab. Remember to fold the patient's sleeves at the preparation stage. Locate the brachial pulse on the forearm. Wrap and fasten the cuff so it fits snugly on the arm, 1 inch above elbow, with the arrow pointing to brachial artery. Close the valve of the BP cuff. Step 3. Measurement. Place the stethoscope diaphragm on the brachial artery and locate pulse. Inflate the cuff until you can no longer feel the pulse and inflate 30 mm of mercury beyond. Deflate the cuff slowly at 2 mm of mercury per second while listening for a pulse sound. Note reading when you hear the first clear regular pulse sound. Continue listening until sound disappears. Note this reading. Open valve to deflate completely and remove cuff from patient. Document the reading and maintain patient record.
Always remember to complete your documentation after the procedure. Please keep the following points in mind when taking the BP of a patient. Click each step to know more. The patient should be relaxed and ready. No eating, drinking, smoking, etc. for 1 hour before the test. Have the patient seated for at least 5 minutes. Maintain the correct position. The patient's arm should be at the same level as the heart. The BP monitor should be on the flat surface at eye level of the nurse. Right equipment and attachment. Select right size cuff for patient arm. Small will show higher BP. Large cuff will show a lower BP. The cuff should be placed correctly, 1 inch above the elbow, and fastened tightly. Inflate to above 30 mm of mercury, no pulse, and deflate slowly, 2 mm of mercury per second. Correctly identify the sound, Korotkov scale.